Hello, you're back. It's nice to see you again. Another day, another lesson, anatomy and physiology, and we're going to be taking a closer look at the medial thigh. And of course, that refers to the muscles of the medial thigh. Muscles of the medial thigh include the pectineus, the adductor brevis, the adductor longus, the adductor magnus, the gracilis, and the obturator externus. And those muscles obviously play a large role in the adduction of the hip and a minor role in the flexion of the knee. We'll start with the pectineus. As you can see here, the pectineus is a rather small muscle that has its origin right here on the pubic bone, or the pubis as we know it, and it has its insertion point on the medial superior femur. So the top part of the inside of the femur, just below the lesser trochanter. The adductor brevis is one of three adductor muscles in this group: the adductor brevis, the adductor longus, and the adductor magnus, and they go in order of size. So you see here the adductor brevis, which has its origin on the inferior symphysis pubis, right here being the symphysis pubis, and we are just below that, and it has its insertion point on the medial part of the femur, as you see. The adductor longus is longer than the brevis, and again it has its origin point on the pubis, and it is just lateral to the symphysis pubis, and its insertion again is on the medial part of the femur and a little bit lower than the insertion of the adductor brevis. Now, as you see here, we have the adductor magnus, and you can clearly see that it's the largest of the three adductor muscles. It has its origin on the ischial tuberosity, and it has its insertion on just about the full length of the medial femur, and you'll see it run all the way down to the bottom here, ending at the medial epicondyle, and there is a passageway within the tendon of that muscle that allows for the passage of vessels and nerves to pass down into the lower leg. The next muscle, which is a very long, slender muscle, is the gracilis, and the gracilis has its origin on the inferior symphysis pubis, as you see, and it has its insertion not here on the medial epicondyle of the femur, but it curls down around behind the knee and comes out here onto the anterior portion of the tibia, just below the tibial tuberosity. The last muscle in the adductor group is the obturator externus, and if you remember your anatomy, you'll know that right here underneath this muscle is a large opening in the pelvic girdle, and that is called the obturator foramen. So the origin of the obturator externus is around the foramen, and its insertion point is on the back of the superior part of the femur, and it is just back posterior to the greater trochanter of the femur, and of course this being the greater trochanter, and you see the insertion here on the back of the bone. Now, looking at the actions that these muscles cause, first off we have adduction of the hip, and you all know from your previous studies that adduction of the hip is the hip moving back in towards the midline of the body, and the adductor magnus is primarily responsible for that. We have knee flexion, and there we have knee flexion decreasing the joint angle at the knee, and the gracilis plays a very, very small role in knee flexion. And the last action we will look at is lateral rotation, and lateral rotation is moving the knee outward, coming towards us as you're looking at this sagittal view, and the muscle responsible for that is the obturator externus. Alright, for a quick review, on page 63 we will run through the muscles one more time: pectineus, adductor brevis, adductor longus, adductor magnus, gracilis, and obturator externus, and the roles they play in adduction of the hip and a minor role in flexion of the knee.